I'm honored to be invited for this conference. What can we do? That's the question I would like to discuss with you. This beautiful map, global map, this global map, use of electricity. This global map, use of firewood. What is COPD? It's such a difficult diagnosis. The GOLD guidelines adapt their diagnosis every year. So why should we be able to give a very simple diagnosis? We should understand it's a result of different things, symptoms, pulmonary abnormalities, lung function impairment, all result from environmental genetic factors. It's very complex and heterogeneous. You heard the story about so many people having COPD. More than 3 million deaths, probably in low-income country. And so the deaths surpasses the combined mortality of malaria, TB, HIV in Africa. Just give it a place in mind. And COPD is unknown in Africa, especially in rural areas. People don't know what you're talking about. There's no public health planning. The people are completely unaware of the dangers of the risk factors. And tobacco smoke has been seen as the main risk factor. Probably is biomass fuel exposure, the biggest risk factor globally. What's funny, data on COPD related risk factors are scarce. These are prevalence surveys done in Africa. And you see the results are very diverse. Very low prevalence of COPD, a much higher prevalence of COPD. And that has to do with age. Often is done above the age of 40. It's often done in urban areas. So there's a lot of work to do. We talk about biomass fuel use. We just show quickly how they cook in Africa. 3 rocks in a pot on top. And affects women, the children, and the vulnerable people. And biomass fuel use is related to poverty. What about healthcare workers in rural sub-Saharan Africa? They know a little bit about asthma, but COPD is totally unknown. If someone has symptoms, it's called TB negative. Spirometry inhaled medication is not available. And treatment exacerbations, antibiotics, tablets of salbutamol, and amlophenol. That's what happens. And a person with COPD in Africa doesn't have diagnosis, accepts symptoms as a part of life, has no idea about the risk factors, and has no medication. And it's often stigmatized. So we have a big problem. There's a lack of national protocols and guidelines. In 2014, COPD was not even mentioned in the national guidelines of Uganda. 5 years ago. There's a large knowledge gap in primary care providers. And health resources are limited. There's, of course, a high prevalence of infectious disease, but there are hardly any pulmonologists. Uganda has 6. Ethiopia, more than 100 million people, 9 pulmonologists. That's what we're talking about. And rural communities, and that's a high percentage of Africa, they experience inequities. They have poor access to healthcare, and as I said before, no medication available. Things are luckily changing. So the poorest and the most vulnerable people have the highest risk to develop chronic lung disease. And I believe the prevalence of COPD is much higher than we think, because most prevalence surveys done, what I said, above age of 40. We found in our study almost 40% were between 30 and 39 years of age. The people, the young adults, a completely forgotten group. They're never involved in prevalence surveys. And what we know, the socioeconomic status also gives a higher chance of developing COPD. But there's more growing evidence which is linked to low birth weight, malnutrition, infections, exposure to pollution. Hey, we're talking about environmental factors, child factors, maternal factors. So it's not only about cooking. Let's go back to the normal lung development. First is the growth phase. Did you know that the airway development is finished in the 17th week of gestation? Later on grows until young adulthood. Then there's a plateau phase, which is about 10 years. Then there's slow, natural decline. That's how lung function develops. But we know, what we know right now, there are childhood disadvantage factors which influence lung function. Pre- and postnatal, preterm birth, low birth weight. There's a direct correlation with low birth weight and lung function at 40 years of age. Malnutrition, arterial factors like diabetes, asthma, smoking, air pollution, childhood factors. They all have an effect on the lung function in the early 10 years. And they never catch up. So the bad start and the plateau phase is much lower. So the chance of developing COPD later on age is much higher. This all applies to low-income countries. So decline of lung function in childhood could be reflected in adult lung function. Low adult lung function in early adulthood shows in long adulthood increases chance of developing COPD at older age. But we also know low lung function adulthood increases chance of developing cardiovascular disease, diabetes, dementia. So we're talking about non-communicable diseases as well. This is what I told you, and what this means for African lung health. It's about the childhood disadvantage factors. So this is a question I asked you, and this is about the air pollution, the silent killer. Pollution linked to poverty, house and air pollution linked to industrial development. This is going to happen, so we really have to react. And if you look at COPD prevention, these are the causes of COPD. We have to use tobacco consumption, ambient occupational air pollution. We're going to talk a whole afternoon about occupational air pollution. Reduce household air pollution, combat infectious disease, and most important, social economic upliftment. That's vital. So if you want to do something, you have to do everything. I don't believe in bringing a new cook stove solves the problem. That's one issue. So we have to optimize lung health before birth, early childhood to prevent COPD and other incidents. And we have to work together. That's the only way. We can't do it by ourselves. We have to work with youth institutes, with policymakers. So the epidemic of COPD is growing. This former speaker explained that. Raise awareness, everybody, population, policymakers, and physicians. Prevention is ultimate goal, and there should be public health goal. And more research is absolutely needed. Thank you for your attention.